Hey Camp followers, day 3 with the lovely Carrie. So we are doing this amazing gift to you guys where we're talking about how to prepare for cruciate surgery. Because cruciate disease, really big problem, medium to large breed dogs, middle-aged females, we've been through it. That was day 1. But it is a leading cause of stifle arthritis. And I'm the big arthritis baby. I just am desperate to make sure that these dogs are more comfortable for the rest of their life. So this is why Carrie's here. She's going to give you all the tips that you need to make sure that if you are heading towards surgery, or even if you've chosen not to do surgery, these are fundamental things to have in place to make sure that the surgery is successful, not only during the surgery, but after it. And your conservative approach has got the best chances of working. So crack on, Carrie.
All righty. All right, we'll go back to the screen. And of course, you guys are all going to go watch day 1 and day 2 because you don't want to miss anything in this amazing presentation.
Amazing.
Amazing. All right. So we want to talk a little bit about everyone in the family. And we touched on that a little bit last time, but everybody in the house needs to know what's going on with the dog. And particularly if you have kids, everyone has to be invested in what's happening with the dog. So make sure everybody knows the rules. All right. So the first few weeks, there are a lot of no's happening. So no off leash walking. We talked about this yesterday. They've got to have a short leash. You've got to have the leash on all the time. You put the leash on before you even open the door, and they're leashed constantly. And they're not even really going for a walk yet. All you're doing is going out and toileting at this point. No running. That's why you need to have that short leash on. Dogs love to run. They want to take off. They don't have the same kind of precautions and self-preservation that humans do. So if you or I had just had a big knee replacement, we wouldn't even think about running. But because we go, oh my God, I'm going to be pain. We think about what could happen if we do this. Dogs don't do that, right? They see something, they take off. So we really, really want to make sure they're not doing any running. And that includes running in the house too. So want to make sure they're in a smaller area so that they can't run after the cat or run after the kids. So be very
I think that's
careful.
so important. Just did a lecture about puppy exercise and myself dividing exercise to in the house, in the garden, considered exercise, and exercise where people don't go, oh my God, that's exercise. I already thought about it. It's just a whiz to the shop, or they're just popping out to the car, or whatever it might be. But do think about those things in the garden, in the house, considered exercise, and those things that kind of slip through the net and it's still exercise, but they don't fall into a category. Be aware of all of it.
That's right. And even on a short leash, a dog can get up into like a lunge, right? And kind of a jump. So we want to make sure, even if you're just going out like to get the mail and it's literally 2 feet from, make sure you've got a leash on, because you just do not know what that dog might do. And you do not want to go through any complications of surgery. We're trying to make sure there's no infection. We're trying to make sure there's no complications. You don't want to go through this phase again with your dog, because this is the hardest phase, these first couple weeks, right? No stairs, generally no stairs until 6 or 8 weeks. The surgeon and the vets will let you know really when your dog is able to start to do stairs. If they need stairs, you're going to use your assistant. You're going to either pop them up, you're going to carry them, or you're going to use your grocery bag. So generally try to have them in an area where they don't have to do stairs. If you're going in for an appointment to your vet a week later, make sure this dog isn't jumping in and out of your car. That's normal for them to be able to do that. When you're bringing them out of the vet clinic after surgery, you're going to have a way to lift them in and out. So think about that. If you're a frail person who just had shoulder surgery and can't possibly boost your 100-pound lab into the vehicle to pick them up at the vet clinic, you better bring someone with you, right? So think of things like this ahead of time so that there's no surprises. And so when they come out of the vehicle, they've got to come slow. So have the leash on in the car, have them by the collar, help them down. We've had a couple people who on the first day home had to come back because the dog jumped out of the car, because that's what they do. So,
and I think people
really
also
critical.
have to be really aware that it's about being preemptive and not looking for the dog to give you clues.
Mm-hmm.
People will say to me, well, he didn't groan. I didn't hear any noise. He didn't seem to find it painful. And you're like, no, they don't. They just do it. So be really aware of, if you had major knee surgery, it is going to be painful. It is going to be sore. It is going to be vulnerable. Just protect it. Don't wait for clues that something's painful to them. Please don't.
That's right. So be preemptive about all of that, and get them in an area where they're not going to be able to hurt themselves. And we talked a little bit last time about furniture. So not letting them get up and down off the furniture unless it's at a safe height for them. There are dog stairs out there. You could bring in something so that it's easy for them to get on the couch or get on the bed if you wanted to, but we don't want to see any jumping at this point. Now, what does your dog do when you come home from work? Because most often you're not going to be home 24/7 with your dog that first week after surgery. And so if your dog is roaming the house and the doorbell rings, what happens? If you get home, what happens? Does your dog normally jump on you as soon as you open the door? Like my dog, I expect him to be at the front door, and I know he's going to jump up as soon as I open the door. Well, we don't want your surgical dog doing that. So this is why you're going to need to have them in some kind of protected space. So again, the laundry room, block off the kitchen, give them a bedroom, give them some space where they're not going to hurt themselves, but they aren't able to jump on you as soon as the door gets open.
Yeah, good advice.
And if you have other dogs in the house, do not let them play together, because dogs don't know, and they wrestle, right? And even if they're in a confined space, they can still wrestle, and so that knee can get tweaked really easily if you're not careful about wrestling with other dogs. So you really want to keep them kind of apart from the other animals in the house during those, I would say, probably the first week. What about you?
No, I totally agree. And I think no matter whether it's cruciate or talking about general arthritis, those scuffles can be a big problem, especially around feeding times or putting leashes on to go out for a walk. There's such a hustle and bustle, and you can just picture it. It's on a tiled floor near the back door, and vulnerable, slightly weaker dog is getting a bit bundled to the side.
Exactly.
We're talking about movements that we just don't want that area or any painful joint to be having to go through.
And so that's a good point, Hannah. So if you have multiple dogs, and a lot of households have multiple dogs, then let the other dogs out one door, take your post-surgical dog out a different door, have them on the leash, like keep them separate so that they can't do all of that stuff in the yard or even around feeding time. So you're going to feed them in the room that they're living in, for the first few days, and not have them try to, get the other dog's food and push and shove and stuff around the bowls.
And I think the biggest tip is one for human nature. Like, this is me. I'm totally nightmare. Luna's got a thing at the moment where if I open the back door, there is this routine where she has to run down the garden. And it's just got, she's a collie. That's what they do. Yeah. So we've been working at really trying to decondition her. So she doesn't always do that. And when you just get a bit slack, you just get a little bit lazy. You know what's going to happen. It's going to happen, but you're just a little bit pushed for time, and you try and get away with it, don't you? And then, So just don't do it.
That's right. So, and you do have to remind yourself, right? Like, because we get into habits, and so it's hard sometimes to break those habits, but if you put things up on the fridge, or, a note by the door, a little sticky note, leash on, or, separate dogs, or whatever, these, little sticky notes, almost like you might have Alzheimer's, and because you keep forgetting all of these little things. So, so just put them up around the house. Yeah. All right, let's talk about the cone. Do you guys use a cone over there?
Yeah, we've got all different variations. We've got the hard cone, the soft cone, we've got the comfy pillow. there's actually a trend now where somebody's making comedy cones, and I saw the other day, which was awesome. Okay, so it was a dog's head in a cone. Inside of the cone was like a McDonald's fry pot, you know, there's all these yellow chips and in a cone. I just thought that was amazing.
That's awesome, because then at least you have fun looking at the cone.
Yeah, there was another one. I think the dog looked like an ice cream. There was that array of
because I think the problem is we feel so bad when they look, you know, when they look so sad in the cone, and we're the ones that are like, oh God, you know, do we have to have this?
Yeah, I haven't. A lot of dogs tolerate them really well. It's the back of your legs that just don't cope. You know,
yeah.
Forbid it be the summer, you just end up having self-harm wounds all the way down your calves, don't you?
Exactly. So it's really, really critical that your dog does not lick the incision. And there is an old wives' tale that, you know, oh, the dog's tongue is clean and they're cleaning out the wound. Well, guess what, guys? No. You don't know where that tongue has been.
Yeah.
So, you know, this is how dogs get infection. And so I have a confession to make. My golden, she had bilateral cruciates done at the same time. So she was a mess. So the surgeon decided to do both knees at the same time. And she's all stapled up and she's looking very sad in her cone. And we're, I don't know, 3 days in maybe. And she's a really good dog. And so I thought, oh, I'm just going to give her a break for a little while. So I take the cone off. I literally go into the kitchen to make some coffee or something. I come back less than 5 minutes later. All of the staples are out. And I have a gaping wound on not only one knee, but both knees.
Oh my God.
So and I'm in the profession. like this is not good.
You look like a bad person.
Oh my God. So get back in the car, back to the surgeon. I work at the vet clinic, and he's like, oh my God, Carrie, what were you thinking? I'm like, oh, she looks so sad. So, you know, just like clean out the wound, restaple. Of course, she got infected. So now, 2 more weeks of antibiotics. And so I learned my lesson. Do not trust them.
No, back to the same thing. Same with Luna running down the garden. Same with Luna and cat food. The power of what I would like to do when your back is turned is way strong.
Yeah. I thought she was perfect, and she wasn't. So do not take off that cone, no matter how sad they look. And now the other thing I want to mention was talking about treats. So we're going to use a lot of treats over the whole rehab process when we start exercising these dogs. So you want to, because remember we talked about weight. Hannah was talking about how weight really affects arthritis. It's one of the reasons they tear in the first place, and they're not doing a lot of activity right now. So they're not burning a lot of calories, right? So when we use treats, because we need the treats because we want them to start to do these specific exercises, you're going to use something really, really small. Dogs don't really care so much about the size of the treat. It's the fact that they're getting something. So you can just use your kibble, right? You could use little bits of something, bits of carrot or broccoli. If your dogs like vegetables, work great, right? So don't give them a big milk bone every time they do one exercise, because we're going to use these a lot through the day.
I've been doing that with Luna. Do you know what the most cost-effective and really simple thing I've found to do, which she absolutely works hard for, is those tins of frankfurters, and I chop them into, literally they're about 1 to 2 millimeter squares. They're tiny, and then I bake them. So tiny little cubes. It will last me a week, 2 weeks.
Because you only have to give them 1 cube. Like they're getting a reward, and it doesn't have to be a big reward. It's because dogs are driven by the smell of this, right? Not so much the volume of it. So, think of that ahead of time and have those already in stock. You don't want to have to be running to the pet store 48 hours into your rehab going, oh my God, I don't have any small treats. I don't have anything, right? So,
and then you see it happen a lot, especially like puppy training and dog training. People have really, really high reward food. So chicken breasts and gammon, and you're like, no.
Something really little.
Every day.
Yeah. So stock up on those before surgery. All right, let's talk about icing. Now, physios love frozen peas, and frozen peas are still my go-to for icing. Now, icing can definitely help reduce inflammation and reduce pain. And I think pain control is one of the big things we want to actually use icing for. Now, is icing is big over here, Han? I don't know what it's like over in Europe. Would you guys ice a lot, or?
I think there's some people that do, and I think they tend to be the people that got a rehab focus. I have to admit, before I became wiser, which I am a bit wiser now, it wouldn't have really crossed my mind as a GP vet. So I became a bit obsessed with arthritis about 7 years ago, and then it all kind of came together, but I can't remember suggesting frozen peas for an inflamed joint prior to that, because I just hadn't been taught it.
So peas make a really easy way to ice. Generally, it's recommended anytime you have swelling and pain, it's generally recommended. So that would be after surgeries or injuries, we tend to want to use ice. Even if you don't use ice, definitely don't use heat in the first probably 72 hours, because heat can actually create more swelling, and it doesn't really help the pain. So if you do anything, then use ice rather than heat. Now, again, go shopping before you bring your dog home, because you want to have these already in your freezer. Now, the other thing I would recommend is write the dog's name on the peas. Because I have had people say, oh, I think these peas have melted 5 or 6 times, but I think they're still okay to eat. So, you know what? Just use them as ice packs. Don't use them for your
otherwise you're going to be eating a lot of peas.
Yeah,
a lot of peas.
Really, just if they're the dog's peas. So don't, cook with them afterwards. So get the peas before they come home, and so you're ready to use them. And generally the recommendation is for 10 to 15 minutes, 2 to 3 times a day. Now, here you see me saying 2 to 3 times a day. So what does that tell you?
At least once.
At least once, right? And if you're only going to have time to ice once, I would probably do it at the end of the day when the dog's kind of a little bit relaxed anyway, not kind of just before mealtime, because they have to kind of lie down and kind of relax with the icing. So better to do it a few times a day, especially in that first week. Generally, you don't need to do it after the first few days, because the swelling is starting to come down and the healing process has already started. But those first kind of probably 4 or 5 days, I think icing can be really effective. So at least once a day. Now, here is the trick that I use for the dogs. So I take 2, if you've ever iced yourself, it's that first initial contact where you go, oh, right? Because it's really cold and it doesn't feel very good initially until your nerves kind of get numb, and then it feels fine and it actually helps the pain. But that first minute or so of icing is not usually very comfortable. So we're trying to make this a little bit more comfortable for your dog. So here's what we do. So we're going to take 2 small hand towels and we're going to wet them with warm water. Then we're going to take a bag of peas and wrap them in each wet towel, and the towel is still warm at this point. And so the dog is lying on his side with the surgical leg up, and we're going to put one bag under the knee and the other bag on top of the knee. So we're basically going to sandwich the knee. At this point, these towels are still a little bit warm, so this isn't super uncomfortable right now. But so the warmth makes it easier for the dog to handle. And then it doesn't take very long, a minute or so, and that cold is going to start to seep through, but it's going to seep through gradually. And then, within your 10 or 15 minutes, you're going to have a nice ice pack there. So it just makes it a little easier to start with. And don't use dry towels. Dry towels don't conduct cold very well. So you're much better to wet the towels and with the warm water, and then put them on. Have you ever tried that technique?
I have, since I spoke to you last time. I like it.
Yeah, it's just a little bit easier way to do it. You feel a little bit better, your dog feels a little bit better, and then you're just going to lie down with him, and so the dog needs to be supervised because he's just going to get up and walk away, right?
Yeah, so get some podcasts ready, get some music on your phone.
So set your timer, 15 minutes.
That 10 to 15 minutes can drag if you've got nothing to distract you.
Oh, exactly. Throw your Netflix on, do whatever you want to do, but just lay down. You know what? Lay down with your dog and just have a cuddle with them. So it's just gonna make them feel better. And again, if you do it before bed, sometimes they can sleep a little bit easier, right? Because they're not so achy through the night. So
totally love it.
All right. Okay, so we're gonna go to the prom tomorrow. So you're gonna tomorrow is prom day. All right.
Cool. Awesome. Okay, so we are day 3, day 4 tomorrow, and then there's another day. So this is the whole week with Carrie, and we'll see you tomorrow.